636, 17 Newsmakers, and as if the issue of healthcare reform weren't controversial enough just yet, there is a new tax in the proposed healthcare bill that is giving a lot of people, well, some wrinkles. It's a tax on nips and tucks. It's being called the Botox. It's a 5% tax on cosmetic procedures and surgery. So here to discuss this proposed tax is plastic surgeon and reconstructive surgeon Dr. Darshan Shah, who joins us live in our newsroom this morning. Dr. Shah, good morning to you.
Good morning.
Okay, so the Botox, from what I understand, this money will actually be paid directly by the consumer, not by the doctors themselves. It will be collected by you, though.
Exactly. It's collected by the doctor, and usually what will end up happening is it'll become part of the overall fee, and the doctors are responsible for turning that over as part of the taxes.
So, doctor, give me a picture. How much is an average procedure? I know it kind of varies depending on what kind of procedure, but an average procedure cost, and what kind of cost would it add given this tax?
Well, you know, procedures in our field range anywhere from a couple $100 for a simple injection of Botox all the way to quite a few $1,000s for a facelift or major abdominal reconstruction like a tummy tuck.
And so Harry Reid, the lawman who's working to get this through, Congress, says he wanted to keep this tax. It's been proposed before in different forms in different bills before, but he wanted to keep the idea in healthcare, so he said, why not do a tax on cosmetic procedures? And Dr. Shah, why not tax something like this with something that appears to be kind of like a luxury tax?
Well, there's a couple of different reasons for not taxing cosmetic procedures. One is it's been tried in New Jersey, and it turned out to become an administrative nightmare where it costs almost as much to administer this tax as it did to actually the amounts of funds that they collected for it. So they're working on repealing it. 8 other states have repealed this tax, or it's gone through some form of legislation, and then they've decided not to institute it because it is such a difficult tax to enforce. There's a big gray line between...
One of the things that, because the average person at home is thinking, plastic surgery, I'm thinking of a Hollywood star making $20 million. Those people can afford plastic surgery. It seems like if you can afford plastic surgery, why not tax it and help healthcare out a little bit?
Exactly. And, that's where most people have a little bit of a misconception. Most of the women getting plastic surgery, and they are mostly women, 90% of people getting plastic surgery are women, are working class women making less than $60,000 a year. In fact, 80% of the people choosing to have Botox and other cosmetic procedures are working class women that are making less than $60,000. So it's not a luxury tax. You're unfairly targeting women that are out there working, trying to make a few extra dollars and spend it on things that make them feel better.
And how would you, because this is one of the things you just mentioned, is the difference between reconstructive and cosmetic. Doctors or the lawmakers are saying here, we're going to use the Medicare standards here, but and trauma and accidents, things like that are going to be covered, no taxes, but you say there's going to be kind of some gray areas. A lot of things are not covered.
Exactly. And, Medicare does have codes for something like a breast augmentation, but we use implants in congenital abnormalities, we use it in reconstructive purposes, and who's going to draw the line between what's considered cosmetic and what's considered reconstructive? Another great example is a C-section scar after having a baby. Well, removing that, is that reconstructive or cosmetic? It's hard to differentiate sometimes.
All right, Dr. Darshan Shah coming in this morning to talk about the so-called Botox. We'll have to see if it is included in the bill that eventually does or does not pass through Congress. There's a lot of things up in the air right now. Dr. Shah, thanks for coming in this morning.
You're welcome. Thank you.
And straight ahead here on 17 News at Sunrise.